China right now, we see the majority of people, they're experiencing mild to asymptomatic symptoms, but the country's focus right now is really to cure those severe illness. As I said, most of the severe illness are taking place in elderly people or those who are with underlying or chronic health conditions. So, Dr. Ren, let me ask you, what are some of the measures or some of the ways that we can detect if the elderly, I know you started to talk about this already with the heart rates and also with the blood oxygen saturation device. What are the other ways can we detect if those elderly folks have have symptoms or they should immediately go to the hospitals?
Yeah, thank you for the question. I will start it by it's better for you to getting to know the basic condition of the elderly population. Or take me, for example, if I live with my grandma, I should get to know her basic condition. What is a basic heart rate? What is a basic blood pressure? What is the basic respiratory patterns look like? Because as I mentioned before, sometimes the elderly person cannot have the strong enough body responsiveness to the COVID-19 infection. So other than the temperature, we need some other parameters to help us to tell the severity of the true situation. And besides, if you have the extra like the equipment devices, as I talked before, like the oxygen oximetry, that's a very simple clip, just to clamp on your finger.
Yeah.
And that would be better for you just to have detection of your oxygen saturation. But there were some other symptoms that you need to, pay attention. One is a tachycardia, which is Dr. mentioned before, that is really fast, beating fast of the heart. But sometimes for the elderly person, they may lose of their appetite. So during the infection phases, they may cannot take enough like the water intake or the food intake. But for the people who have like the diabetes before, and if you are using the insulin before, right, for now, they don't eat enough food. They will have the dizziness and they will have the tachycardia. I mean, not only the elderly person be sent to the hospital because of the COVID-19 infection, sometimes they will have the newly onset of the other, like the acute diseases. For now, it is a winter time, right? For us, because my major was neurointensive care, so I'm dealing with a lot of stroke patient. If at this time, right, with the painful stimuli, or if you do not have the really a good blood pressure control, you may feel sudden attack of the numbness on your face, paralysis of one of your limbs. That might also an indication that you might have the newly onset of the stroke. And this time, don't hesitate, just go to the emergency department for the check. That's number 2. And number 3, that once you're not feeling well, because right now we're following the one rule that we will hospitalize the patient whenever needed. So especially for the vulnerable population, if you are not feeling right. So don't hesitate and just go to the hospital for the closer monitoring.